So the last presentation dealt with the anatomy of the lungs and passage of air. Now we're going to talk about the mechanics of breathing, how we get that air into our lungs. So in order to inhale, the volume of the lungs must be increased. This lowers the pressure in the lungs, drawing the air inwards. So the diaphragm contracts and moves down. So when you breathe in, it moves down, intercostal muscles contract, expanding the rib cage. So what that's going to do is it's going to open up and it's going to pull air in. Now, when you want to exhale, the opposite occurs. Lung volume decreases, pressure increases, forcing air out. So the diaphragm relaxes. So when you exhale, you can feel it almost that the diaphragm is relaxed. And then when you inhale, you're pulling the diaphragm down. So that's why you always hear people talk about you have to have strong abdominal muscles for cardiovascular activity, because breathing over and over can actually become tired because that actually is a muscle. Okay, so you understand that we do have voluntary control of our breathing. You could sit there and hold your breath, or you can breathe really, really fast if you wanted to, all right? But they're all also know that when we are sleeping, your breathing is regulated by your brain. Okay, your body is going to control that while you're sleeping. It's going to be your brainstem is going to help to control that, because obviously when you're sleeping, you're not thinking about breathing. So summary respiration: air is inhaled through the nose or mouth. Air flows into the pharynx, passes the epiglottis, moves through the larynx. Air travels down the trachea into two primary bronchi, which lead to the lungs, and the primary divide into secondary and then tertiary bronchi. So that's a good up to the tertiary bronchi. Now, oxygen diffuses from the alveoli into the blood. Carbon dioxide diffuses from the blood to the alveoli. Then we have blood is returned to the heart, where it is pumped out to the rest of the body. So once the oxygenated blood pumps back to the heart, and then we have it go to the rest of the body. The left ventricle pumps it to the rest of the body. So blood diffuses out of arteries and into blood cells. Mitochondria use oxygen to break down glucose and ATP, cellular respiration. Non-respiratory air movements. So a cough is a sudden rush of air outward. It clears the lower bronchi. A sneeze, similar to a cough, but air is directed out the nose, meant to clear the upper pharynx and nasal passages. Hiccups, short, sudden inspirations caused by spasms of the diaphragm. And a yawn is a very deep inspiration, ventilates all of the alveoli. So, smoking, what it's going to do to your cilia. The normal slide, this is a normal slide of tissue from the trachea. All right, you see H is going to be the cilia, pseudostratified columnar cells in I, J is mucus, and L are basal cells. So look what's going to happen with smoking. This slide is a tissue of a few years of smoking. The columnar cells beginning to die out. They're replaced by basal cells, and many cilia are also damaged or destroyed. That's why smokers have that cough in the morning, because they have to cough out all the mucus that normally would be passed by the cilia. Now, this slide is from a heavy smoker after several years. Ciliated columnar cells are completely gone, replaced with basal cells, some of which are cancerous. Without cilia, smokers are unable to expel phlegm, causing the smoker's cough. So they're not able to do that at all. Take a look at this. Tissues that support the shape and function of the alveoli in the lungs are destroyed. Alveoli are unable to maintain their shape after exhaling. The bronchioles and lung tissues can also become filled with tar and other compounds from the smoke. So it is not good. Black lung. Inhaled coal dust progressively builds up in the lungs and is unable to be removed by the body, leads to inflammation, fibrosis, and cell death, similar to the damage caused by cigarette smoking. So if we see on this slide, the bottom right here, we see progressive massive fibrosis in 4-year-old coal miners. So black lung is something, they may not be smokers, but the inhalation of the coal dust causes damage similar. Asthma is an inflammatory disease that can obstruct the airways and cause spasms of the bronchi. The airway is narrow, causing symptoms like wheezing and shortness of breath. A combination of factors such as exposure to pollution and genetics can cause asthma. Bronchitis, ain't nobody got time for that, is an inflammation of the mucous membranes of the bronchi. Acute bronchitis is usually a result of infection from a virus or bacteria. Chronic bronchitis is caused by prolonged exposure to irritants such as cigarette smoke or other pollution. Pneumonia, inflammation of the lungs resulting from an infection. Swelling of the bronchioles constricts airways and fluids leaks into the alveoli, reducing respiratory function. Causes bacteria, viruses, or fungi that spread to your lung. More likely when respiratory defenses have been compromised by smoking or AIDS. Okay, so all can lead to it. We obviously know that the coronavirus can cause damage that leads to pneumonia as well. Cystic fibrosis, inherited disease resulting from a defective gene on chromosome number 7, causes mucus cells to produce dense, viscous mucus that cannot be transported by the cilia. Inability to remove the mucus causes breathing problems and opens the lung to bacterial infections. Unfortunately, individuals rarely survive past age 30 without some kind of major treatment. Tuberculosis, caused by Mycobacterium tuberculosis invading the lung. Highly contagious and leading cause of death by infectious disease. Treated with antibiotics. Some strains are resistant to antibiotics. Okay, so you hear about resistant tuberculosis. You will get a TB test before college where they inject you under your skin and see what happens. All right, so if the bubble, if there's a reaction with the bubble, that shows you whether or not you are positive or negative for tuberculosis. Pneumothorax is a collapsed lung. Occurs when air escapes from the lung. It fills up the pleural space outside of the lung. This buildup of air puts pressure on the lung so it cannot expand like normal. Puncture, it could cause by puncture wound, gunshot, or broken ribs can also do that. Carbon monoxide is an odorless, non-irritating toxic gas caused by combustion in automobiles, gas-powered tools, heaters. Carbon monoxide has a higher diffusion coefficient than oxygen, will bind to hemoglobin. So what's interesting about carbon monoxide is it'll bind to the hemoglobin on red blood cells and prevents them from carrying oxygen. So we see right here, here's what's happening with carbon monoxide poisoning.